High and low uric acid levels, causes and treatment. Uric acid levels are typically 2.5 to 7 milligrams per deciliter in males and 1.5 to 6 milligrams per deciliter in females. Low levels are rare, but high levels can lead to gout, kidney disease, and other health issues. Uric acid is a waste product in the body. Sometimes it builds up in the joints and tissues, causing various health problems. Having some uric acid in the blood is normal. However, if uric acid levels go above or below a healthy range, this can result in health problems. High uric acid levels can increase the risk of gout and kidney stones. If a person is passing too much uric acid, the levels in the urine will be high and the levels in the blood will be low. How does uric acid build up in the body? Purines are chemical substances that occur naturally in the body, as well as in some foods. When the body breaks down purines, uric acid is the waste product. The kidneys filter it from the blood and pass it out of the body in the urine. However, uric acid can sometimes build up in the blood. Homeostasis is a term describing the body's attempt to keep levels of various substances in the normal range. If the blood level is too high, excretion will increase. In the case of uric acid, most excretion is via the kidneys and urine. High levels of uric acid in the urine can lead to the formation of kidney stones. Symptoms of high and low levels. A person with high or low uric acid levels may not always have symptoms. Symptoms may not appear until a person has had levels outside the normal range for an extended period, which can cause health problems. Symptoms of gout, which high uric acid levels can cause, include painful or swollen joints, joints that feel warm to the touch, shiny discolored skin around the joints. Symptoms of a kidney stone, which high uric acid levels can also cause, include back pain, pain in the side, frequent urination, cloudy urine that smells unusual or contains blood, nausea or vomiting. Low uric acid levels are less common than high ones. A person with low uric acid levels may urinate more than usual, which can cause dehydration if they are not drinking enough water. Related medical conditions. Some medical conditions and treatments also have an association with high uric acid levels, particularly gout, kidney disease, and some cancer treatments. Gout. Gout is a form of arthritis. The symptoms come and go, usually affecting just one joint. In people with this condition, uric acid builds up in the joints and tissues, causing pain, swelling, and discoloration. Gout most commonly affects the toe joints, ankles, and knees. Cancer treatment. When cells die, they release purines, which, when the body breaks them down, release uric acid into the blood. Some cancer treatments, such as chemotherapy, cause cells in the body to die. Uric acid testing may be part of medical care for a cancer patient. Kidney disease. The kidneys filter waste from the blood, including uric acid. Kidney disease damages the kidneys and stops them from working. When this happens, waste products, including uric acid, can build up in the blood. Fanconi syndrome. Having low uric acid levels is rare. In Fanconi syndrome, uric acid is not reabsorbed at the typical levels. leading to excess urine and low serum levels. Fanconi syndrome can cause a lack of energy, dehydration, and bone problems. A person with this condition will have low uric acid levels because too much of this substance is passing out of the body in the urine. Treatment of high and low levels. Certain foods contain purines which create uric acid when the body breaks them down. Eating a diet that is too rich in purines can cause uric acid to build up in the blood. It is not possible to avoid purines altogether because small amounts are present in many foods. However, a person can follow a low purine diet and take other steps to help lower purine levels. Foods and drinks that include moderate or high levels of purines include alcohol, bacon, turkey, veal, organ meats, shellfish, trout, haddock, anchovies, sardines, herring. A person with gout may wish adopt a low purine diet for the prevention of uric acid kidney stones. Non-steroidal anti-inflammatory drugs and steroids can reduce pain and inflammation, helping treat an acute gout flare. People can take steps to prevent gout flares. This include avoiding alcohol, reaching or maintaining a moderate weight, protecting the joints with gentle, low impact exercise such as walking, cycling and swimming. A person who has gout usually needs a uric acid test every 6 months. Keeping uric acid levels within a certain range can reduce pain, joint damage and complications from gout.